Welcome everybody, bienvenidas y bienvenidos to this forum, community forum on COVID-19 and vaccinations from a Latinx perspective. We will begin soon. Please join us with the comments and let us know where you're from, and we will start in a minute. Welcome. Good evening and welcome to all. I am the Reverend Amaury Tañón Santos, Faith Community Liaison for the COVID-19 Prevention Network of the National Institutes of Health. I also serve as the Executive Director of the Schenectady Community Ministries in the Capital Region of New York State. It is our privilege to have you join us for this conversation opportunity hosted by the Nuevas Fronteras Presbyterian Church in North Plainfield, New Jersey, the COVID-19 Prevention Network, and the Ad Council's It's Up to You campaign. We welcome everyone joining live and also those who will access this conversation in the future. We invite you to share your comments or questions in the chat section of this webcast. We will hear from each one of our speakers first, and I'll be curating your comments and questions as part of our conversation in the second half of our time together. I want to thank the Nuevas Fronteras Presbyterian Church and their pastor, the Reverend Dr. Victor Elodio, for hosting this webcast as part of their commitment to sharing trustworthy information about the pandemic and the vaccine, grounded on a Latinx perspective, and as part of their commitment to be a learning community with and on behalf of La Comunidad. It is my pleasure to introduce you to my friend and colleague, Victor Elodio, the pastor of our host faith community, with a greeting.
Thank you, Amaury, and good evening to you. And I look forward to this, our third segment of our conversation, an opportunity by which we are bringing information to our communities, and grateful for the opportunity for the various organizations that we are partnering with, as well as with your leadership in bringing forth and networking with both community leaders and experts in the medical field. And so on behalf of Nuevas Fronteras, we'd like to take this opportunity to welcome each and every one of you for this evening's conversation. We are strong advocates of making sure that we provide venues by which individuals are able to communicate with one another. I believe that during this time of pandemic and as well the distribution and rollout of vaccines, that we need to be transparent. We need to ask questions. We need to be able to provide information accordingly, and information that is provided from reliable sources. So thank you so much for this opportunity. Once again, we welcome everyone this evening, and may God's grace be upon you. And I look forward to having the conversations with the wonderful panel that we have gathered today.
Thank you, Victor. Would you open us in prayer too, please?
Sure. Let us pray. Lord, we come to you at this moment thanking you and praising you for another precious day. Grateful that you have given us this opportunity to meet como una comunidad, as a community, oh Lord, to learn from our community leaders and from experts in the medical field. We are grateful because we know that you have provided talents and gifts, particularly during this time where there is where there is a reflection of hope, oh Lord, in our communities, and for that we are grateful. Guide us in our conversations, and Lord, provide us wisdom and illumination. Open our hearts and minds to hear the information that is provided, and as well wisdom to discern, oh Lord, with that information, the next steps. We are grateful to you today and always. In the precious name of Jesus, amen.
Amen. Thank you, Victor. Tonight, I'm glad to join in the presence and expertise of 4 leaders and professionals. Combined, they are a powerhouse with over 100 years of service in public health, community and social organizing, and religious leadership among and on behalf of migrant and Latinx communities in the United States. First up will be Pastor Julissa Alvarez Garcia. Julissa is a pastor, a mixed media artist, and a public servant with over 25 years of service currently in the U.S. Social Security Administration. She studied biology and Spanish literature in the Pontifical Catholic University of Puerto Rico and at Bloomfield College in New Jersey. She also has a certificate in pastoral leadership from Princeton Theological Seminary. Julissa's pastoral, community, and women's development work is coupled by her being the main caretaker of her mother. These experiences have placed Julissa up close and personal with the manifold challenges the Latinx community has encountered during this pandemic. I look forward to Pastor Alvarez Garcia's perspective on this conversation. Bienvenida, Julissa.
Gracias. It is a pleasure to be here. Excited for the opportunity to serve and to share important information for our community, particularly those who are the most vulnerable, those who have so many questions. So I'm honored to be with all of you and grateful for the opportunity. Thank you. Thank you, everyone.
Gracias, Julissa. After Julissa, we will hear from Dr. Jorge Moreno, an internal medicine physician. Jorge is also assistant professor at the School of Medicine of Yale University in Connecticut. His academic, clinical, and research interests include the health of Latinx community with a particular focus on obesity and related diseases. In the spring of 2020, Jorge was among the first medical teams deployed by the Yale University Hospital to develop strategies and implementation procedures for the hospital's response to the onset of the COVID-19 positive patients. More recently, Dr. Moreno has been an active Latino spokesperson in community health and vaccination efforts by the Yale University Hospital and the state of Connecticut. Professor Moreno studied biology at Columbia University in New York City and medicine at the School of Medicine and Dentistry of the University of Rochester in New York. Thank you for being with us, Jorge.
Thank you for having me, Amaury. This is a great opportunity to really get information to our Latinx community, and that's very important. We're very close to turning the corner on this pandemic, but we need to do this with teamwork. And I think I spoke about this last time, but it's a village, right? So we need to get all together and come together to end this pandemic. And we're going to have a great discussion about the various things we can do in the community for this.
Thank you, Jorge. The third speaker will be Dr. Julie Levison, an internal medicine physician with expertise in infectious diseases. Julie is assistant professor at the School of Medicine of Harvard University in Massachusetts. Her clinical and research interests include HIV, migrant community health, and infectious diseases, and services around infectious diseases provided in a community-based context. Dr. Levison has been at the forefront of community engagement with Latinx and other migrant communities around education and access for these communities on the ongoing response to the COVID-19 pandemic, especially in the Boston area. Dr. Levison is a member of the Infectious Diseases Society of America and the American College of Physicians, where she's a fellow. She's also a research scientist in the National Hispanic Science Network. Dr. Levison was named the El Planeta's Power Meter 100, a list of Massachusetts 2017 Most Influential People for Latinos, and is a recipient of the Arnold Gold Foundation Leonard Toad Humanism in Medicine Award from Harvard Medical School. Thank you for being with us, Dr. Julie.
Muchísimas gracias por la invitación. I'm so happy to be here with all of you. I could not underscore as well as Jorge said, this is a family and community pride moment that we stand really to turn the corner on the pandemic. We're getting there. The light at the end of the tunnel is so close, but we need each other. And so I am so thankful to all of you to welcome us to this conversation tonight. We'll get there.
Gracias, Julie. The fourth speaker will be the Reverend Dr. Victor Elodio. Victor is the pastor of our host Nuevas Fronteras Presbyterian Church, a pan-Latinx and increasingly intercultural congregation in North Plainfield, New Jersey. He's also the Associate Dean for Institutional Diversity and Community Relations of Princess Theological Seminary in New Jersey. Pastor Elodio did religious and sociology studies in the College of New Rochelle, New York. He has a Master's of Divinity degree from Princess Theological Seminary and a Doctor of Education in Higher Education Administration from the University of Pennsylvania. His pastoral work and his leadership in higher education in the areas of diversity and inclusion have placed him front and center in the response to the COVID-19 pandemic. Issues of access, treatment, and vaccinations have been core to his leadership in pastoral and education during the pandemic. Victor, thanks again for hosting this conversation and for the perspective you will bring.
Thank you, Amaury. And once again, we welcome and we are so appreciative of Doctora Julie Levison, Dr. Jorge Moreno, La Pastora Julissa Alvarez Garcia, and for your leadership, Dr. Amaury Tañón Santos. So thank you, and I look forward to the conversations.
Thank you, everybody. So for a little context as to why we're gathering, in the late winter of 2021, earlier this year, Victor, Julissa, and I met with other community and religious colleagues to begin conversation about what would it take to engage with La Comunidad, by which I mean the greatly diverse Latinx community we serve and come from, in providing accurate, timely, reliable, and contextual information in response to the pandemic, encouraging nuestra gente to get vaccinated when the opportunity arrives, and deploying our networks to bridge the gap of access that many in our community continue to face, continuing to build a sense that the wellness of one is the responsibility of everyone. For in the end, we cannot all be well if any one of us is not well. No. This is our third conversation that we are hosting, and the first one in English. We thought it was important to host some of these conversations in English for many reasons, but I want to highlight two of those. First, hosting a conversation of the COVID-19 pandemic in English from a Latinx perspective is an acknowledgement that the Latin American community throughout the United States is diverse in many ways, not the least of which is language. As part of our commitment to bring reliable, timely, and contextual information to nuestra gente also means we need to bring it in a way our people will understand it. And the English language is one of the many languages spoken by our people. The second reason is to provide resources for community, religious, and medical leaders who are engaging with nuestra gente to build our resilience. Nuestra gente expects and demands contextual information, period. In this conversation, and perhaps others that we will host, we are hoping to provide some important framing for leaders in Latinx communities to better understand not only what information or framework of engagement to use, but how to do so. To begin the conversation of better strategy, to begin the conversation of better strategies to engage with our comunidad. Although not unique to the Latinx context in the United States, many of us would much rather be engaged with. That is, not work on us or at us, but work with us. It is that contextualizing of leadership, that working with and alongside the people, spending time in relationships that will build the trust of the members of the community in our religious and public health institutions. It does not elude anyone in migrant and Latinx communities that the communities far more affected by this pandemic in the United States have been Indigenous, Black, Latinx, and migrant communities. Anecdotally, those of us who are religious leaders have learned that the way many of our people are asking for information about the pandemic is with us because they do not seem to find information from official sources. In my estimation, that speaks either to distrust that many have in our community, right, to government officials, or to the lack of access to such information. And of course, when we talk of access, I mean that not everyone has access to a computer or to cable, but I also mean that there's lack of contextualized information. A flyer in Spanish does not make a flyer contextual. It may not even be a flyer that is needed. It is about deploying the information through trusted and relied upon sources. Government needs to do the hard work of identifying and cultivating those sources that are trusted and relied upon in La Comunidad. And our hope is that conversations like this will highlight trusted and relied upon sources like the 4 exceptional leaders we will hear from in a moment. This conversation adds its contribution of that of agencies like the COVID-19 Prevention Network and the Ad Council, who have done careful work in getting to know Nuestra Comunidad and set out to share reliable information about the pandemic, healthcare, and the vaccine. This is our way of creating a space of encuentro among community leaders to continue to strengthen our will to better the health, social stability, and economic development of Latinx and other communities of color in the United States. We will now hear from Pastor Julissa Alvarez Garcia, followed by Dr. Moreno, Dr. Levison, and Reverend Elodio. Please remember to share your comments and questions in the chat, as they will surely encourage our conversation. With us, Pastor Julissa Alvarez Garcia.
Thank you, Mauri. As you clearly stated, I think all of us have experienced in the last few months the raw pain of our community. I talked lately with friends and colleagues about the pandemic fatigue and how many of us sometimes are going in circles, not really understanding everything that we have to do, but the battle is there and we continue to fight it for the welfare of our churches, our communities, and our own personal families. I think a mix of factors come into play on the discussion of COVID-19 and the vaccination. As a bivocational pastor and a public servant, I have seen the raw pain of people who are suffering, of people who are struggling on an everyday basis. We represent a large number of essential workers. Our churches, our communities are those who were working from the very beginning. They never stopped working. We saw a lot of the consequences of being overexposed to environments that were not safe. We saw a large number of people getting very sick because of different factors. We lost a lot of our friends, and also, and I know in some churches they lost several church members. So I think we are in pain, and we have to recognize that in our struggle to get people vaccinated, to show compassion, and to listen to the conversation, and to listen to the doubts that people have, because they're valid. They have gone through so much in the last, what I call the last 60 weeks between 2020 and 2021. I personally have seen how many of our brothers and sisters who are undocumented have faced a great deal of challenges financially, the lack of health care, the lack of health insurance, and not going to the doctors when they don't feel well or not getting the proper treatment has also been a problem. Health insurance, for example, I'm a public servant for the federal government, and I have seen how many families have been affected with the care at home of family members that were sick, and they had no other choice but to stay home and care for them. And many of them also became sick. A blessing for the Latino community is that we are a what they call a multi-generational households. We have our grandparents, other family members living in the same household. And even though people criticize it, what a blessing to have family members care for children who are learning from home, who cannot go to school, and they can stay with them while the parents need to go out and work. But at the same time, I think that also was a challenge because you may have younger people getting sick because they were exposed to different venues and bringing that the virus home. And because of that, we know of several family members in groups that we know of that are gone. But I think the immigrant population, for example, there are limitations. There's so many limitations when it comes to the vaccine. Initially, how do we have access? How do we get people connected? How do we provide assistance to do it online when people didn't have um, internet, for example? Many of our family members in our local communities are still struggling with connectivity issues or knowing how to navigate through the process. And also, I think that our communities do not trust the federal government and other social agencies as a consequence of the anti-immigrant movements that have taken place in the last few years. Talking in the field with different people, there's a mistrust in our communities. We have a historical precedent of providing information that is not always accurate. So when people are showing concerns about the vaccine and the side effects and what could happen 2 to 5 years from now, we need to understand that it doesn't get fixed overnight. It's a conversation that has to take place, and us as leaders and those in positions to help others have to be available to do that. For example, the CARE Act that supported so many millions of family members was not provided for people who were undocumented. So even though they were seeking help and they were trying to find the best way to care for their families, they didn't have the same resources that many other families had. So the government has failed many of those families in need to provide access. How do you transport people who are seniors and they don't speak the language to vaccination sites? How do we provide help? Just getting the basic, sometimes information that you don't need to have a driver's license. You don't need to have a US passport. Whatever ID you have is enough to get yourself vaccinated. And there are ways of getting yourself connected to the right resources. So the work is there. The work has been challenging. And also the barrier of the language for many people. The news have not provided all the information that is needed. Many of our communities have been affected. The layers that have been affected are so many, and they're only touching base on the area of vaccination and the pros and cons of different types of vaccines. But I think that we need to have real conversations like this, not only in our current situation, but on the major news. Spend more time communicating and giving people a chance to talk and listen to each other. Also, one of the big reasons that people have been questioning the system, I think, is the latest news about Johnson and Johnson. They compare Johnson and Johnson with all the vaccines. They said, "Pastor, you see what happened with Johnson and Johnson? I don't know if it's a good idea." So I believe that the best way for us to help our communities is to understand the different needs of the Latino communities. Because why they're so skeptical about what has been shared with them. Recognize that we have been saturated with misinformation about the vaccine, and we have to give them the opportunity not only in Spanish but also in English because of the generations that live in the same household. Maybe their grandchild doesn't speak Spanish, but if they understand the information in English, they're able to bring the information home and talk about it with family members. So I think there's a lot of questions that have not been answered, and I think that we need to be proactive, but most importantly, share your personal stories. Share how you feel after the vaccine. What happened to you? For example, as a personal anecdote, yesterday I had a member who said, "I have allergies today and I don't feel well. Should I go and get myself vaccinated? My appointment is today. Should I get my vaccine?" I said, "Absolutely. Go to the center, speak to them, tell them how you feel, but let them make a decision. Don't miss your appointment. Go there, tell them exactly what your symptoms are, and they have medical doctors, they have nurses, they will be able to assist you." So it's not having all the answers as faith leaders. We're not doctors, but we can definitely have that positive outlook in sharing the personal stories and how we're now gathering together in churches, how people who are vaccinated feel much more comfortable visiting those family members that we have not seen in so long and caring for one another. In my particular situation, we were so careful in the first phase of COVID because we didn't want my mother to get sick because she's weak, her health is compromised. So our commitment was to her, for her to be well, but to tell them how much more of an opportunity to see the world, to just go out to a park, even having ice cream outside means as a gift of scientists and as a gift from God in a way as a miracle from the scientists that prepare and work so hard on this virus and be positive about it. Share the good stories of how good you feel, and not only for COVID. We don't know what's coming next. We don't know what other diseases, what other pandemics may occur. We have to be prepared. So, what an opportunity this is to be the church, to be the face of God, and to provide a lending hand for those who need it the most. Thank you.
Thank you, Julissa. And now we'll hear Dr. Jorge Moreno.
Hi, everyone. And again, thanks for the invitation. And that was a great discussion the discussion starter that Julissa mentioned. I echo a lot of the same concerns that she had, and I echo that we are very close to the end of the tunnel. So as you know, I was in the COVID unit back in April of 2020 and in March of 2021. And I can tell you that there are very big differences in the patient populations that I saw. In 2020, we had no vaccines, we had no real protection for anybody, but the elderly were disproportionately affected. In addition to that, the young Hispanic Latinx adults were affected. And if we take the numbers of the death of younger than 50-year-old, that the highest number were members of the Latinx community. And so it's very important to note that this disease has really disproportionately affected us, not only because most importantly, because we were essential. Most of the Hispanic population was essential workers, and they work jobs that are more exposed, whether it's in grocery stores, healthcare, you name it. We work all types of things, and a lot of the Latinx community can't have the luxury of taking a day off or work remotely. So that really exposed us. So now the opposite is happening with vaccines, right? So we're in the lower end of the vaccination amount percentage in the United States. Various states have different numbers, but at the end of the day, we could do better, a lot better in our community. And I think that in order for us to get there, we really have to have the information and know that the vaccine is one of the biggest tools we have right now to get back to normalcy, get back to where we what a new normal that we've created now in 2021. So with that, one big difference that I saw in the COVID unit now is that there were very, very few people that were older than 65. And that's because early this year, they were eligible for the vaccine. And but unfortunately, at younger than 50 were not vaccinated, and they were the biggest proportion of patients that were hospitalized back in March. Now the vaccine across the country is anyone older than 16 is eligible, and that's so at any point you can even have a walk-up appointment. So there's a lot of various ways to get your vaccine. So in order to get to what we call herd immunity, we need 70 to 80% of the entire population to really be immune. Herd immunity is this term that we use, but it's basically community immunity, right? So right now, we know that our children younger than 12 years old cannot get vaccinated because they're not eligible yet. But the adults can get vaccinated. And so if we all are barriers for this virus we can protect our children, and we can protect others that are not vaccinated. And so having this proportion of this percentage, 70 to 80% of herd immunity or community immunity is essential for us to get back to our normalcy and to have control over the virus. So last year, the virus has controlled everything, our lives, and it's really kind of made restrictions. We're, quarantined. And so now with the vaccine, we can control the virus again. And so if we prevent more infections, we also prevent new variants, which I know many of you have heard, and sometimes it's confusing to understand why these new variants formed. But the simple explanation for variant forms developing is that replication leads the virus to become smarter and develop new techniques to make us sick. And so, but if we use a vaccine to protect us against that, then there will be less variants and we'll have more protection. So now that I get a lot of questions about the vaccine, so I'm gonna just give a quick overview of the 3 vaccines, and I'm happy to answer any questions in the chat in more detail. The 3 vaccines that are authorized right now by the emergency use authorization by the FDA are the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson. Pfizer and Moderna are mRNA vaccines. And this is a technology that basically uses a piece of genetic material. It's almost like a picture of a very small portion of genetic material from the virus. And that is identified by your immune system, and it's allowed, and basically what it does, it memorizes it. The mRNA is destroyed, and you have this memory that you know how to attack the coronavirus if you do get infected by it. So the two of them that are available that are mRNA are Pfizer and Moderna. Pfizer is 21 days between the first and second dose. Moderna is 28 days between the first and second dose. And it's very important because there's a lot of new evidence that people are skipping their second dose. And that's very important to avoid, because after the first dose of Moderna or Pfizer, you're only about 50% protected, 50-50, and you won't have the response that you need to get fully protected. So even if you delayed the second dose, just go and get it right away. If you, it's 21 days for Pfizer again and 28 for Moderna. And then with regard to the Johnson & Johnson vaccine, there's our next guest, Dr. Levinson, is going to talk about the Johnson & Johnson plus in more detail, but the basic mechanism of how it works is it's an inactivated viral vector, an inactivated virus, where it's just transporting the similar information than the other vaccines, but it's just using an inactivated virus. So it's not a live virus, and it's again, information for the immune system to recognize, and so that the vaccine, so that your immune system recognizes the coronavirus and attacks it when it's found. And so that's in a nutshell how these work. All vaccines have been shown to decrease hospital stays, have decreased severity of disease, and the need to go to the hospital for oxygen and things like that. And they've been now shown to decrease death. So this is great. As an example of successes in Connecticut, this week we had the first weekend since September without any COVID-related death in the nursing home. And so nursing homes are like now over 70% vaccinated. So that's great news, right? That's evidence that the vaccine is doing its job. So that's the gist really of what the vaccines and how they work. The last thing I'm going to touch upon at this point is just a couple of questions and concerns that come up with many of my patients in terms of the misinformation out in social media. Number one is the fertility of men and women is not affected by any of these vaccines. There's no evidence of that. In fact, women that were part of the study that were not pregnant, some of them became pregnant during the studies and had the vaccine, and there was no evidence of any differences in outcomes for them. And there was a preliminary study about pregnant women that showed that there hasn't been any big red flags in terms of safety with the vaccine. Additionally, a lot of people ask, will it interfere with my diabetes, with my medical conditions? It won't. And in fact, if you have diabetes or other medical conditions like heart disease, you should get the vaccine to give you a protection, because you're more likely to have a severe case of the COVID-19. In addition, I get a lot of questions about whether your genetics is affected. And like I said, the mRNA is basically disposed of, and then after your immune system identifies it and creates protective antibodies, then there's no interaction with your DNA. So there's really not any evidence of that at all. And then the last question that I often get is, why is it so fast? Why did this develop so fast? And why is it not fully approved? So we had one problem in 2020, coronavirus. All our resources were put in to develop these vaccines. And so this technology were available, but all the resources from multiple countries, multiple organizations, where they were trying to get this to roll out. So that's why it was done fast. And the authorization versus approval question, authorization is just because it's a quicker process, and when the benefits outweigh the risks, they approve it quicker for the FDA. In a couple of weeks, Pfizer appears to be able to get the full authorization. But more to come on that, and it's probably going to happen for Moderna and Johnson & Johnson in the near future. So that is the last myth I get is about religion and whether this is approved by my religion, and in particular the Catholic faith has a lot of concerns about embryos and what. But the Pope actually received the Pfizer vaccine, and he said it's a moral obligation to get the vaccine. So I'll leave you with that, and I'll let Dr. Levinson take it from here.
Thank you again so very much for having me. It really is an honor. I work as an infectious diseases physician in Chelsea, Massachusetts, which has been heavily affected by COVID. We're right near the airport. For those of you who have come to Boston near Logan Airport, our community is about 60% Latino. At least half are foreign-born. We are mostly essential workers, so in the front line. So our community was vulnerable to COVID. I want to talk a little bit about that experience, and my orientation also is one as a researcher committed to health equity. And I think we've learned so much. We knew about health disparities and structural racism that has been going on for centuries before this. But COVID-19 certainly has shown the tremendous inequities that exist in our communities as well as in our public health system. So when I think about our response to COVID-19, it's not only an issue of public health, but I think we could all agree that this is an issue around equity and justice. So I'll give you one example about how that has shown the case in Massachusetts. In Massachusetts, 12% of our residents who are Latino have been vaccinated. And you could say, well, our population of Latinos in Massachusetts is 12%, so that's equal. But you can also understand that a big portion of our essential worker population is Latino, and our Latino population has been heavily affected by COVID. So we should really expect that number to be higher, much higher, because we need to protect those who are most vulnerable. So what does that really mean in terms of our strategy for COVID vaccination? And I'll go a little bit earlier to what we learned in the outbreak as COVID emerged in Massachusetts in March. We began to see in our health facility, we're part of a very large health system called Massachusetts General Hospital and Brigham and Women's Hospital. We have this community health center. We serve the town of Chelsea with supposedly 50,000 individuals. When you look at the census, we're probably closer to 70,000 given the number of individuals who are not on the official documentation. And when individuals were coming for testing, our COVID test positivity was almost 50% later in the spring. So we had a lot of individuals who are heavily affected, families losing family members. And what we learned was how important it is to bring services to where people are. It is not enough to offer testing in the hospital or testing at a distant site, but we have to bring it door to door to where people live. We have to make it as easy as possible. And so that means really understanding what our community's needs are. How is it going to be easiest to get the services? And so those sort of lessons that we learned from testing in COVID also have been the case in terms of vaccination. And I'll talk a little bit about that. I want to mention a bit about the term resilience. We hear a lot of stories about suffering. And within those stories of suffering, there's so much loss, of sickness, of death, of the challenges of losing jobs, of issues around shame sometimes in terms of getting sick or when a loved one gets sick. We also learn of stories of tremendous strength. And I think that's one of the strong points of these kind of conversations when we come together as a community. For example, the religious community, where are people coming together bonding together, sharing resources, sharing food, sharing information. It is those moments of strength, even in moments of poverty and moments of where resources are so limited, where people band together and become so creative. And we had that experience in Chelsea, in our town where I work at this community health center. Every day we had a call at 4 o'clock, and it ended at 4:30 with a prayer from one of our religious leaders. And we went through every facet of life. So someone spoke about mental health, childcare and education, housing and food. We went through the list. What was the update for the day? And people came together. There were over 100 people on that call, and it was an efficient call, but it was one that saw people and the community as whole individuals, even in the moment of crisis. So I mentioned the importance of resilience and how even in the midst of suffering, we can be so creative when we come together. One of the success stories in our town of Chelsea has been the vaccine response, which really has come from the ingenuity of our community members. We have one organization in particular I want to highlight, La Colaborativa, which is a women-run organization. They have a large food pantry. They also offer employment assistance and help with immigration concerns. And we have been walking around on Saturday mornings, and the way that is led is there are a group of community health workers who are trained about COVID, and we divide up physicians, medical students, nursing students, and we have a couple of health professionals with a community health worker. We divided up the city by blocks because in the wastewater, the sewage from the toilets, you can evaluate the amount of SARS-CoV-2 or the amount of virus that causes COVID. And so we focused our walking on those street blocks that had the highest amounts of COVID. And we met people on the street, women walking with their children from the market basket. That's our local supermarket. Parents putting their babies in the car seat in the back of the car. And what happened first? First, the community health worker would make an introduction. She would give a bag that would have surgical masks and hand sanitizer and a thermometer and replacement batteries and say, hi, feliz dia. Make an introduction. I come from this organization. I can help you with food, with all sorts of things. And by the way, I'm here with this physician, Dr. Julie, and she can answer any of your questions about the COVID-19 vaccine. And so that's how we've been going, hand by hand, person by person, sitting down together, asking and answering questions, and mostly listening. People have so many wonderful questions. I want to say it is such a privilege to answer questions. As a physician, I really enjoy when someone asks me, how does this vaccine work? Should I get it? Should my children get it? That's what it means to be a physician and why we go into the profession. So I really encourage people to ask questions. And then I think as we look ahead, it's so important not only as healthcare professionals that we're positive when the evidence and the scientific data say that these vaccines are safe and effective. We're coming here to encourage people to take the vaccine. But it's also important, I think, like Julissa was saying, that we help people see that this vaccine, along with all of the other measures that we know save lives, like washing hands and staying home when we're sick, or wearing a mask if we don't have a vaccine and we're with people who have not had a vaccination, that all of these strategies together can help get our families back together, our communities back together, can help people get back to work so that they can earn an income and help protect and help their family grow, which I know is so important. So it's so important that we link the vaccine to help people imagine the beautiful future that we can have. There is still so much work to do. I want to comment at the end now on two points. One is about children. So 20% of the US population is children. So that really means we need to find a way to see this vaccination campaign as a family and a community campaign. The Kaiser Family Foundation, which does these large surveys across the nation, interviewed about 2,000 people in the middle of April. And half of those adults, so about 1,000 adults, said they had concerns about their children receiving a COVID-19 vaccine. That means that we really need to talk about that as a community. As the data comes out from these studies, it's important that we be able to give the positive encouragement. I anticipate that there'll be an approval, which is called the emergency use authorization for a vaccine for children ages 12 to 15 soon. That phase 3, the studies showed 100% efficacy and safety in children, and I anticipate by the fall that there'll be approval for children ages 2 to 11. So I'll pause there. There may be questions about the Johnson & Johnson study. What I will say is one of the things that has come out walking in the streets and talking to people and listening to my patients, they have very important questions. A lot of people have had concerns about the J&J vaccine. And when we hear something that sounds scary, like these very, very rare cases of blood clots, people have concerns and may not want to take the vaccine. And I just want to say briefly, this is the Johnson & Johnson vaccine, as well as AstraZeneca in Europe, had the report of a rare event of a blood clot. Now, I want to pause and say one of the reasons that we know that these events occurred was because of a very important system of monitoring and surveillance or vigilance for side effects from the vaccine. And I hope that everyone, when you get your vaccine, that you will enter in, there's a system with the Centers for Disease Control where if you have a symptom, which may occur, that you enter it there so that they can understand more about potential side effects, which are very rare. So what happened was that there were, to date, 16 cases out of 7.5 million people. So that's a very, very small number. And if you thought about the percent, it's 0.0002% of people who received the J&J vaccine who had this very rare event. And I just want to emphasize that this is an overall exceptionally safe vaccine. And the fact that the vaccine trial paused really shows more that we have a system that's watching out for potential side effects and being extra safe and careful. I'll stop there, and I welcome any of the questions from the community.
Thank you, Dr. Julie Levison, for the opportunity to provide us with this much needed information. I am grateful for as well the opportunity to share with you some information from the perspective of a theological stance in regards to the matter of examining, exploring, providing information so that individuals can discern their decision in pursuing the vaccinations. But before I begin, I would wish to share the following 1-minute presentation for you in regards to the fact that it is necessary that questions are asked in this regard. You are given the opportunity to ask questions and to seek responses and to discern accordingly, to ask for guidance from religious leaders or counselors, facilitators, in order to make your decision. This platform, this forum, is so that in that way we are able to provide this information accordingly. And you have heard from our panelists today of the importance, if we are to prepare ourselves for a new normal, not return to the way things were, but to prepare for a new normal. We need to be aware that these issues of this pandemic is going to be with us, but we need to be proactive, and we need to move forward accordingly as medicine and community leaders and religious leaders hand in hand work together in providing the necessary information. So I share with you at this moment the following presentation for your consideration.
Actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
As we can see, there are leaders within the medical field that have given us particular information. But it is important to also note the fact that we are having the opportunity to ask questions. Yet it leads me to share with you about how do we, as people of faith, respond accordingly in regards to this virus and vaccinations. How should we, as followers of a particular tradition, followers of Jesus, think about the COVID-19 vaccine? The rollout of the COVID-19 vaccines has been met with both excitement and skepticism. There is great hope that the vaccines will bring an end to the devastation that has been caused by this terrible disease. But conversations about the use of vaccines have also been marked, as we have been hearing from our panelists, by confusion and fear. As followers of the church and of Jesus, we have committed ourselves to love God and to love our neighbors as ourselves. Therefore, the issue of immunization is not a matter to be taken lightly. We must think biblically, theologically, ideologically about this vital issue. And it is our hope that through these conversation that we are able to engage with the community in this reality. One of the questions that I've been asked consistently is, what are vaccines? Vaccination is a way of protecting people against harmful diseases before they come into contact with them. It uses your body's natural defenses to build resistance to specific infections and makes your immune system stronger. Vaccines accomplish this in a variety of ways. The currently approved vaccines for COVID-19 give your body blueprints on how to fight the virus that causes COVID-19 without giving you any amount of virus itself. If you are then exposed to the virus in the future, your immune system can quickly destroy it before you become sick. Another question I'm constantly being asked is the COVID-19 vaccine unsafe because it was developed so quickly? The federal government has been working since the start of this pandemic to make a COVID-19 vaccine available as soon as possible. This accelerated time is unprecedented, yet this virus is unprecedented. It has upended our world in ways that you and I know in our own personal realities. But it has also raised for some people that safety may be sacrificed in favor of speed. However, as with all vaccines, safety is a top priority. And COVID-19 vaccines were tested in large clinical trials to make sure that they meet safety standards. Many people were recruited to participate in these trials to see how the vaccines offers protection to people of different ages, races, and ethnicities, as well as those with different medical conditions. The FDA and the CDC continues to monitor the safety of COVID-19 vaccines to make sure even very rare side effects are identified. Now, I understand that there is also skepticism and suspicion about these regulatory agencies. Friends, we have these regulatory agencies in order to make sure that with science and with the particular specifications that are needed, we'll be able to provide the necessary resources in order to combat this virus. Another question that I asked as a pastor of a congregation that is composed of predominantly immigrant families from countries from Latin America, is the government going to use the COVID-19 vaccine to track people? There is fear among some people that the COVID-19 vaccine will include some form of microchip that would allow the government to track you and even lead to mandatory vaccination orders. There is an optional microchip for the labels of the COVID-19 vaccine vial, but that hasn't been requested by U.S. officials. If it were to be used, it would only share when and where injections are taking place, if the dosage has expired, or if it is counterfeit. So we need to recognize that there is a lot of misinformation that's found in social media, and instead of solely looking at this information from social media, ask the questions. Go to cdc.gov. Look at the various resources that are provided by your local and state regional agencies that are at this moment looking at and exploring these particular realities. Another question that I'm asked is, shouldn't we just let the virus run its course naturally? I have a few friends that say, well, listen, I've been in my home for the past 14 months. Nothing has happened to me. I've been going ever so often to do shopping. I'm just going to let this virus run its course. Isn't the vaccine a bigger risk? Herd immunity, as you heard from one of our panelists, is achieved when large percentages of a population become immune to a disease and therefore indirectly protect those who do not have immunity. However, the percentage of people who must be immune in order to achieve herd immunity varies based on multiple factors, including the mode of transmission and how easily and quickly a given disease spreads. In most cases, herd immunity, HERD immunity, is not achieved without an effective vaccine. For COVID-19, the percentage of the population that needs to be infected to achieve herd immunity is estimated to be between 70 to 90%. And this is assuming lasting immunity is possible. If immunity is long-lasting, achieving herd immunity in the US without a vaccine would likely require more than 230 million Americans become infected. Friends, why is this public health matter a matter of Christian discipleship? Our faith and obedience in Jesus in discipleship involves dying to ourselves and taking up the cross and following the Lord. We are commanded to love God and love our neighbor as ourselves. Loving other people can involve many things, but at a minimum, it involves seeking their good. The general principle of the common good comes down to benevolence, to love, to care for others, to laying down personal priorities for the service of others. It is not a great sacrifice, depending upon your health conditions, to wear a mask. to stand socially distanced, to wash your hands consistently throughout the course of the day. We, as followers of Christ, thinking about vaccinations, must weigh this key biblical principle in our decision-making processes. Friends, in the midst of all this, if there is still doubt, if there is still hesitancy, my encouragement is to seek guidance. Encouragement is to ask for information. My encouragement is to be able to speak with a spiritual leader, a counselor. There may be traumas that has been historical, completely understandable. There may be difficulties that you have had and you have experienced in your family lineage, completely understandable. But instead of just holding back based upon that fear, friends, what we encourage you is seek the information. Try to have conversations with a counselor, a trusted confidant. We can defeat this. It's going to be incremental, but it needs to be intentional. And so I'm grateful for your participation during the course of this day. And hopefully we look forward to receiving your questions as we continue in this dialogue.
Thank you, Victor. Thank you, Pastor Julissa. Thank you, Dr. Moreno, and thank you, Dr. Levison, for your insights. And now we open the conversation to everyone tuning in. Like Victor encouraged us, please share your comments and questions in the chat, and we'll be curating those as part of the conversation. And to kick off the conversation, I want to invite the speakers to engage each other. And Julissa, I'm going to put you on the spot. What question or idea is percolating in your head after we have listened to Dr. Levison, Dr. Moreno, and Reverend Elodio?
Julissa, you're muted.
Can you hear me now?
Yes.
Hi. I am very concerned about the news in India. And, years ago, what happened in India happened in India. Now we know what happens in England, what happens in India, what happens in Brazil can happen in our neighborhood 2 months from now. So what is really happening, and how can that situation in India affect us here in the U.S.? I guess Julie or Jorge can answer.
Yeah, I think it's such an important question, and it's not just India. It's number of countries in South America. This is a global issue. I think, Julissa, you are so beautifully highlighting our interdependence in the world. It is a global community. We see these boundaries on maps, but bacteria and viruses, they don't know from boundaries on maps. They're much smarter than we are. But I think there's a larger issue. There's so many things we could say. In India, the amount of human loss and suffering is incalculable. One of the issues is, and we see this in some of our states in the United States, is pulling back on public health closure when we think we've done well, and we relax public health standards too early, saying, look, we did a great job. We saw this in the United States, in some states in April, relaxing, opening up businesses too soon. And so in India, initially there was a success with the very strict public health closures, keeping people at home, which is very hard with a crowded country, but then declaring a premature and early victory. One other issue, there's so many issues we can talk about. The other point is the importance of patents in pharmaceutical development. And it raises the issue about how important it is to get vaccines outside of the United States and Europe. And part of that is relaxing those patents that pharmaceutical companies have, so that the vaccines can be cheaper and distributed. The last point I want to mention is about migrants. We have 46 million migrants, refugees, asylum seekers, internally displaced people worldwide. The World Health Organization just did a review of 104 vaccine programs for COVID-19. 70% of them exclude displaced people. India is one of those countries, Nigeria, Indonesia. It means those programs exclude individuals who don't have a defined residence. So, it makes us really think about how important it is to be inclusive as possible. You don't need to have a driver's license. You don't need to show your residency status. We welcome everyone. Not that we will not turn you away. I don't think that's the language. It's we welcome everyone to come. It should be a celebration, not a punishment, to come get a vaccine. So I think you raised such a good question about India because it's about our whole global family.
I'll add on to that a little bit, if it's okay. The other point with India is a comparison point, right? So India has 2% vaccination rate. Israel has a 70% vaccination rate, and in Israel, deaths and hospitalizations are dropping. And in India, we're getting higher and higher hospitalizations and deaths. And so this proves another real world example that vaccinations work. And we have the privilege in this country of having 3 vaccines available right now if you want to go get it. To go get it, right? So just another highlight of does it work? And you see that it does. You see it, and so the other problem is the variants, right? And so the variants in India it's another variant, and so if we keep replicating the virus, we're going to have more variants. So the only way to stop it is with the vaccines.
Julie, I want to pick up on something that you said around, the nuance between everybody being welcome, as opposed to, you're going to get it in spite of your status, and let's bring it, to our context. This is right for both of you, Julie and Jorge on the clinical side, and Victor and Julissa on the pastoral side. Is everyone welcome to the vaccine in the United States? Are there any restrictions other than age at this point regarding the accessibility to the vaccine? And do we know of any anecdotal or study case where the people have been not receiving it, the vaccine, that otherwise that they will be able to receive it? I think that's good information that people would want to hear.
Yeah. So the major everyone, at least the current moment as of today, individuals age 16 and older should get a COVID-19 vaccine. There's only a small group of people medically who are recommended to talk to their physicians really about that. And those are individuals who've had a history of a very severe reaction to an mRNA vaccine before, or the Johnson & Johnson vaccine. So that would be very rare because those vaccines are quite new, and those very severe side effects are very, very rare. So it's essentially, a vaccine for the general population. And in fact, it's just those patients who are socially and economically vulnerable and medically vulnerable that we need them to get the vaccine. So if you have diabetes, if you have cancer, if you have HIV, we really want, if you have lung problems like COPD, emphysema, we want to make sure that you're getting the vaccine. The inclusion is broad. There are very few people who would be ineligible for the vaccine, but I think there's such an important point about the language. I think language can be violent. Language that we use can be so exclusive. So when we say, we'll take you anyway, it doesn't really make us feel welcome. But when we make it a party, when we make it a celebration, when we make it about how beautiful our community is and how much we've overcome. That, I think, is much more enticing. I think you're so right.
I was recently at a forum where there was a lot of concern about undocumented immigrants and them getting vaccination because in Connecticut, there is no law to require an ID. Every state is a little different with this, but undocumented immigrants can find ways to get their vaccine. And in Connecticut, there's no law that you need an ID. And but the information is not always at the site of vaccination, right? So like the source of the information is higher up, but at the site they're still asking for vaccine for ID before your vaccination. And so I think that there's a little bit of a disconnect, and I think that has to be targeted by our community leaders, right? They are the ones on the ground, and they're the ones that need to be empowered with this information so that they can get the vaccine in anybody who wants it and their arms, right? And so I think that that's something that needs to be continued to be advocated in our communities, and also make sure that our leaders can get this message across to the right people. Because at the end of the day, you don't want to deny someone the vaccine when they are eligible for it.
And on the community organizing at the side of things, how do we communicate to our people, our parishioners, or otherwise, that they have access no matter your status. Julissa or Victor, have you had any anecdotal or otherwise experience with people either fearing at the going to getting it, or people feeling comfortable at accessing vaccine in this case?
Yeah, and I want to thank you so much for that question, and I want to respond to that question in connection with what Dr. Julie Levinson said about the issue of messaging, and as well the issue of location. And so what happens is that I know that in New Jersey, for instance, there's these great vaccination sites, right, in Edison and in different locations. Individuals don't want to be within our community. They're fearful about going into these large sites where you have police guidance or U.S. Army, which is needed, right, for organization, etc. But in our context, military presence reminds them of paramilitary situations in their home countries, right? They are reminded about as well sometimes the unfortunate violence that has taken place in Black and Brown communities, right? And so, for instance, in North Plainfield, we have a few of our young adults that are participating in vaccination sites in North Plainfield. And in the past 2 days, they have administered over 500 vaccinations, right, to immigrants, whether or not they have documents or not. The mere fact is that presence within their community opens up, right, the message and the imagery that they are welcomed, that this is important, right? And so I think that for us in our communities, we need to encourage congregations or community leaders that have sites, that have locations, be in touch with local pharmacies, be in touch with particular agencies that you can partner with so that they can come to those locations in their communities in order for individuals to be responsive. The issue of connectivity, confidence, and trust are critical to the messaging.
Julissa, anything? I see you nodding. I have experience.
In my experience, I mean, not only a pastor, but also dealing with people who are disabled, a lot of family members are struggling with having only one member being vaccinated, other members because they're younger or they have not been able to get a vaccine. They're struggling with that. But I also would like to mention that COVID-19 And the vaccine is one aspect of this issue. We have situations in which people who had COVID don't want to get vaccinated because they're still struggling with the side effects of having COVID. Even when they say, the doctor told me I'm ready to take it, I'm still weak. I'm still struggling with what I had gone through. So there's so many different reasons why people are reluctant. But again, as I said at the beginning, it is about sharing positive aspects of the vaccine. These are not the majority of cases. We need to expose people to the good news that this is the answer that we have right now. There's nothing else out there but the vaccine to get people to the next level, to get people to engage again in some sort of normalcy as we had it before. So yeah, we can focus on a lot of the things that people are afraid of. But again, that's not the vast majority. I think we have to continue to promote that this is the only way. This is all we have right now. And as leaders, we cannot stop. It's an everyday conversation. Wherever I go and get something to eat. I ask the person, "Do you get your vaccine?" I go to the local pharmacy and I'm standing in line. "Do you get your vaccine?" I'm asking everyone with a very positive, and I tell them about my experience. And I even tell them after the vaccine, I don't know what it has, but I feel better. And that's what I think we have to share. This is the answer.
Amaury, if I may, as well, according to the New York Times on tracking the coronavirus as of yesterday, May 6th, over a 14-day period from May 6th, there has been a negative 27% of new cases being recorded, right, across the country. There have been minus 4% of new deaths. One death we need to lament, right? One death is too many. But the real fact is that if we were to look at that versus the global percentage, which is up 9% in a global perspective, and that the world new cases has flattened. In other words, that there's 856,000 new cases being recorded on a daily basis. You tend to look at that and saying there are many globally that do not have countries that do not have access. We're having access, and you're seeing the decline, right? We hope and pray that our global sisters and brothers are going to have access. But the mere fact is that there's a sign of efficacy and impact when there are more individuals getting the vaccinations.
And believe it or not, we are about 7 minutes away from 8:30, and I told everybody on the panel that this was going to happen. We were going to get all the way to 8:30. As we close, I'm going to ask first of our medical professionals, and then I'll ask my colleague religious leaders a similar question. Starting with Julie and then Jorge, what would be one or two things in your community, clinical, and research experience and knowledge that you would want religious leaders to be sharing with their communities right now about the pandemic and the vaccine? One or two things you would want Victor, Julissa, and I to be sharing in our community organizing and from the pulpit in our religious services about the pandemic and the vaccine.
I would
First,
say,
Julie, and then Jorge.
Number one, as a physician, I am so grateful to you because you have the access and the respect and trust of so many in our community. We depend on you. So first, thank you for what you're doing and the continued presence that you have. One, I think, is to continue to bring the science in plain, easy language from the pulpit, and to invite physician and public health experts to the community. I know it's harder now that we can't be in the space together, but as more of us get vaccinated, we can come back together. So I think also helping, and you know best how to phrase it, helping people imagine what the future can look like and what the family and the community can look like, to bridge to hope. And I think that you're one of our key links to do that. So I hope that you'll invite me to come back, because these kind of integration of spirit and medicine and public health is really where we should be.
Mm-hmm. Jorge.
You know, and I think Julie also mentioned this before. You are asking questions is normal, and continue to ask questions. And this is what I would tell your congregations, right? Really go ahead and ask these questions, and really make hold on, Papa. Make this movie time. Thank you. And so, yeah, I would really just encourage people to ask questions, and you have to really know where your message is coming from, right? So you can't trust social media. You can't talk to your doctor if you have primary or a doctor you trust. But really try to look at the CDC website, try to look at the hospital websites, the Department of Health. Your community organization has great resources, and you really just gotta get to where is your information coming from, and I think that will be very helpful for us.
Victor and Julissa, a similar question: as religious leaders and people that are tethered so closely and tightly to your communities, what would you want to say, one or two things to clinicians and people who are involved in public health, that you would want to see or hear from them in this situation? First Victor and then Julissa.
I think that one of the most important things is to continue the development of our partnerships, right? This is critical. We have an opportunity today that we've never had before, which is wedding disciplines in order to bring appropriate messages. And prior to this pandemic, there has always been competing forces to gather trust, right, from the community. And I believe that at this moment, I'm just grateful. I'm grateful. And so my comment is based on this, being grateful for the opportunity to be with Dr. Julie Levinson and with Dr. Jorge Moreno, that we continue fostering and cultivating, right, opportunities to provide transparent information and information that we would know how to direct to reliable sources.
Thank you.
Julissa.
Yes, as I always tell people, we first pray and then we go to the doctor. We first, help that person feel the need when they come to church spiritually, with the responsibility to guide them to the right resources, not only when it comes to medical care, but so many other things. So this is the only way. This is the way to get people to understand we are united. We are a united front. We believe in science. We believe that God has the answer for all of us, and He's using our doctors, our medical staff to really bring us to a new level in this horrible time that we have lived. So thank you. I'm continuing to pray for all of you. As I said at the beginning, we're facing a pandemic fatigue. Sometimes I find myself repeating things that I said, 2 days ago. But it is the nature of what we're doing. And we just cannot give up. Just share the hope and knowing that this is almost over. And we're grateful for all that you're doing.
And
Victor.
Thank you, Julissa, for as well sharing that information, right? We need to always be connected. It was interesting that the text from last Sunday was from John 15, which talks about being connected with the true vine, right? And in that, we are able to experience the abundance of life. And that's what our Creator wants of us, is to experience the abundance of life. So we lament with those that have families that have suffered losses throughout this time. We cannot go forward. As a matter of fact, that and their experience inspires us to provide this information. But we need to be connected. And in that connection, we will then be connected with each other, connected with our Creator, and connected with our community. And for that reason, I'd like to share the following slide with you. These are particular resources that one can look at. One is a Christian response to the coronavirus, which is an insightful podcast recording with N.T. Wright, who is a leading biblical scholar, and Francis Collins, the director of the National Institutes of Health. The other is the Centers for Disease Control and Prevention, which is a national public institute. And there you will have that information. Francis Collins, the director of the National Institutes of Health, wrote a helpful blog post about how public health policies have prevented hundreds of millions of coronavirus infections. The other is a Christian statement on science for pandemic times that has been signed by thousands of Christian leaders from around the world, defending science and calling on fellow believers to follow the advice of public health experts during the coronavirus pandemic. And the other is a list of resources regarding COVID-19 that can be found in our church website. And the page is Strengthen Communities. And as well, if you have particular and specific questions on the vaccine, go to getvaccineanswers.org and you will find information there as well.
And we'll be sure to share that that slide at NFC 170 on Facebook and other social media platforms, so you can also share it.
Correct.
The Reverend Dr. Victor Elodio is pastor of Nuevas Fronteras Presbyterian Church and the Associate Dean for Institutional Diversity and Community Relations at Princeton Theological Seminary. Julissa Alvarez Garcia is pastor of Príncipe de Paz Presbyterian Church and a civil servant with the Social Security Administration. Judy Levison is assistant professor of the School of Medicine at Harvard University, and Dr. Jorge Moreno is assistant professor at the School of Medicine at Yale University. I thank each one of you for your time. Julissa, would you please close us with prayer?
Absolutely. Oh my God, what a great opportunity to share the good news with people who are invested in your kingdom, with those that have worked hard to share this miracle of science. Guide us in this process. Provide a new way. Give us the opportunity to be creative in order for us to help our brothers and sisters. Bless our families, especially on this Mother's Day weekend, where we celebrate life, where we celebrate those who love us the most. Thank you. Thank you for this amazing opportunity. Bless every congregation. Bless their families. And stay with us until we meet again. In the name of Jesus Christ, we pray. Amen.
Blessings to everyone and good night. Thanks.
Good night.
Good night, everyone.